Hi, and Happy New Year. My name is Dr. Kelley Wright, and I am a long-term care and retirement home physician in Simcoe County. I am the medical director and attending physician of 5 nursing homes in the area. I wanted to talk to you today about the COVID-19 vaccination, and I hope that today I can give you some good information in order for you to make a good decision to get the vaccine when it becomes available to you. You might be hesitant or even scared about some things that you may have seen or read in social media platforms, news networks, and chat groups. Also, you may have some friends that may have some reservations and you've been talking. I wanted today to dispel some of the myths that I have heard that are common out there, and hopefully will be able to convince you that the COVID-19 vaccination is extremely safe. Unfortunately, the virus has reached the doors of Simcoe County and is spreading rapidly. So therefore, when the vaccine becomes available, this is going to be one of many tools that we can use to help mitigate the risk of transmission and hopefully end this pandemic permanently. I know lots of us are very tired of some of the restrictions that have been going on now since March of 2020. I too share those issues with fatigue. However, I want to tell you that they're very important, and they continue to be the number one most important way that we can fight this virus until the vaccine becomes more readily available. So I'm just going to share with you some thoughts that I have that I put together in a presentation, and I can end with taking any questions that you may have over Facebook or Instagram if you'd like to reach out to me. I want to start out by saying that this presentation doesn't constitute medical or formal advice. Viewers who are watching this must contact their own healthcare professional to decide if the vaccine is right for them. The history of vaccines is very important globally. It saves over 6 million lives. It has developed herd immunity through the measles vaccine and has been responsible for cancer prevention through the HPV and hepatitis B vaccine. It is also extremely cost effective with $50 per life saved compared to ICU admissions and hospitalizations. It's also helped to eradicate diseases such as smallpox and polio, which is only left in 2 countries in the world. mRNA technology, which is the basis of the COVID-19 vaccine, was developed over 30 years ago. There have been some recent advances in this technology and chemistry with the delivery methods that's led to more successful vaccinations. There's ongoing clinical trials as we speak for other viruses such as influenza, Zika, CMV, and rabies. These studies have been extensively and rigorously put through trials for treatments of cancer. So how do mRNA vaccines work? mRNA vaccines are given in the upper arm muscle. And once the instructions are inside the immune cells, it gives instructions to our cells to make a harmless piece of spike protein, normally found on the surface of the virus that causes the COVID-19. After the protein piece is made, the cell breaks down the instructions and gets rid of them. It does not enter the nucleus where the DNA is stored, nor does it modify our DNA. This cell displays the protein piece on its surface, and our immune system recognizes that this doesn't belong in our body and starts to build an immune response, making antibodies which prevent us against the real virus. The current mRNA vaccines that are approved by Health Canada include the Pfizer vaccine and the Moderna vaccine. Both of these are extremely effective. They are both 2 doses. One is 3 weeks apart and one is 4 weeks apart. Their storage is a little different, with the Pfizer vaccine being stored in a deep freeze and the Moderna vaccine being stored in a vaccine fridge. There were over 43,000 trial participants in the Pfizer vaccine and 30,000 trial participants in the Moderna vaccine. And as a result, the vaccine has been approved for adults 16 and older in the Pfizer trial and approved for adults 18 and older in the Moderna trial. The components of the mRNA vaccine are as follows. The mRNA is what encodes for the spike protein for the COVID-19 virus. There's also a component called polyethylene glycol, or PEG, which is a common laxative that is used in colonoscopy prep. It's also got a fat layer, which is designed to deliver the mRNA into the cell. And then the solutions that make the virus injectable include electrolytes, water, vinegar, and sucrose. What is not in the vaccine is lead, mercury, aluminum, or DNA. There's also no live, killed, or altered virus in the vaccine. There are some things that we do not know, and studies are ongoing. Although there were pregnant and breastfeeding women that became pregnant during the trial, these were not specifically studied as a subgroup, nor were children under 16 years of age. However, we have no reason to believe that they would not be safe in either of these populations, nor do we have any reason to believe that they are not safe in autoimmune diseases or immune-compromised adults. We only believe that they won't be as efficacious because they will not mount a complete immune response. They will, however, still protect from serious illness. So we need to keep this in mind when making an individual decision. The other thing we don't know is whether recipients of the vaccine can still be a carrier. So we still need to use all of the social distancing and PPE protocols. Some myths about the COVID-19 vaccine. The first one is, why don't I just wait until I get the virus instead of getting the vaccine? Unfortunately, the COVID-19 virus can cause what we call long haul syndrome with fatigue, shortness of breath, and brain fog. And this is a result of end organ damage that has occurred. And sometimes it can last a long time or even permanently. And we've noticed this in heart tissue, lung tissue, and brain. I would not recommend waiting until getting the COVID-19 virus as opposed to the vaccine, because the COVID-19 vaccine does not contain virus. Myth number 2 is that the COVID vaccine will give me the disease. And as we just discussed, there are no components of the virus in the vaccine. The mRNA simply sends a message for the cells to make a spike protein, which is recognized by our immune system to mount a response. Therefore, it is completely safe. The third myth is that the COVID-19 vaccine will change my DNA. There is absolutely no DNA in the COVID-19 vaccine. It is RNA, which is simply a piece of protein and amino acids that send an email to cells for instruction. And in this case, the instruction is to make the spike protein. As soon as the cell has completed that task, the mRNA is degraded and destroyed by the cell. It does not enter the DNA in any way or alter it. Myth number 4 is that there's too many bad side effects of the COVID-19 virus. The common side effects include pain at the injection site, fatigue, muscle aches, headaches, joint pain, and fever. And these are all signs that your body is making an immune response, which is welcome as a response. Not everybody gets these side effects, and I certainly didn't get them. However, they can be common. But like I said, that is good news in indicating that your body is mounting an immune response. The fifth myth, is that vaccine trials were fast-tracked and not well tested. This is probably the most common fear out there. All the usual steps to approve a new drug were taken with the COVID-19 vaccine. No shortcuts were made in any way. Health Canada and other regulators examined the data simultaneously to not waste any time. However, there were no shortcuts that were taken. These steps were done in parallel. That usually doesn't happen for reasons which I will discuss. There are usually 3 common barriers to medication trials in general. Bureaucracy, where the government takes its time meeting with committees and such to decide if a medication is worth studying. Funding, of course, is a big thing. And in this case, the government paid for the trial by pre-purchasing vaccines. And the third barrier to medication trials in most places is getting a big enough sample size. And unfortunately, due to the raging pandemic south of the border, the availability of willing participants who could be exposed or develop the virus, or sorry, get infected by the virus were plentiful. But did the vaccine trials stop too early? They did not stop too early. However, we must remember that there are many medication trials that occur and have occurred historically, which have stopped prematurely or stopped early because of early success. This happens all the time in medicine. This, however, did not happen with the COVID-19 trial. So myth number 6 is that the COVID vaccine can cause infertility. There is absolutely no evidence that this vaccine causes infertility because there's no virus in the vaccine. However, many viruses out there can cause infertility or miscarriages, such as other coronaviruses and the Zika virus. In fact, the Society of Obstetricians and Gynecologists of Canada supports vaccination of pregnant and lactating women. Again, I would urge you, if you are one of these populations, to speak to your healthcare provider for more information. Myth number 7, and it is not a common one, but I have heard this, that the COVID-19 vaccine contains cells from aborted fetuses. There are no components of fetal tissue in the COVID-19 vaccination, nor were there any unborn babies that were killed to make or test this vaccine. Many discerning Christian organizations support getting the vaccine, including me. Final message is that the benefits of the COVID-19 vaccine far outweigh the risks. For the benefit of everyone's health, we should get the vaccine. Please wear your mask and continue to follow the rules. Thanks very much for listening. I just want to end with one other note. It is common for people to believe that experience informs facts, but in fact, facts informed experiences. I hope today that I have given you enough facts that you can make the right decision for you and your family. Thank you very much for listening. And again, if you have any questions or concerns or want to discuss it further, please contact your healthcare provider, or you can contact me through the social media platforms. Have a great day, and everybody be safe.